Good afternoon, members of the committee. My name is Trish Becerra, and I have worked in early childhood and special education for over 2 decades. Today, I'm here to speak with you about the importance of early intervention, specifically while evaluating preschool and kindergarten children for developmental risk factors is not only beneficial, but essential for their lifelong success. Early intervention means identifying and addressing developmental delays or disabilities in children from birth through age 8. The first years of life are the most critical for brain development. Neural connections form at an astonishing rate, and every positive experience helps shape future learning behavior and health outcomes. Research shows that when developmental challenges are addressed early, children make significantly greater gains in cognitive, language, and social emotional skills. From the Centers for Disease Control and Prevention, CDC 2024. The earlier we provide targeted support, whether through speech therapy, occupational therapy, or social emotional guidance, the more likely children are to thrive academically and socially. Delaying evaluation or intervention often means missing a window of opportunity that can never be fully regained. As Dr. Shonkoff from Harvard Center of the Developing Child reminds us, early intervention is the best investment we can make in human potential. Shonkoff 2021. The benefits to family, its early intervention doesn't just transform outcomes for children, it empowers families. When parents receive guidance and support early on, they gain confidence in understanding their child's need and how to help them at home. A 2023 study in the Journal of Early Childhood Research found that families involved in early childhood intervention programs reported reduced stress, improved communication, and stronger emotional connections with their children, from Dunst and S.B. Sherwin 2023. By providing resources and coaching, we shift from a model of fixing the child to one of partnership, where parents and professionals work together towards shared goals. Families become advocates and collaborate not by bystanders, but by helping in their child's growth and education. Collaboration between educators, specialists, and families is the heart of effective early intervention. Teachers are often first to notice red flags, such as delayed speech, difficulty following directions, or limited social engagement. But families provide the context behind those behaviors. When both perspectives are shared openly, we can develop individualized plans that honor a child's strengths and needs. According to the Division for Early Childhood, DEC, recommended practices, authentic partnerships between professionals and family lead to more accurate assessments and stronger long-term outcomes. That DEC 2022. In short, collaboration ensures that no child slips through the cracks and no family feels alone in the process. Despite the clear benefits, obstacles remain. Some families may feel stigma or feel overwhelmed by the evaluation process. Others may lack access to screening services, especially in rural or underserved areas. To overcome these barriers, we must invest in 3 key areas. That is awareness, increase public education about developmental milestones so families recognize when to seek help. Second, accessibility, ensure screening and intervention programs are available in community settings, preschools, pediatric offices, and child care centers, not just specialized clinics. Number 3, affordability, provide funding so cost never prevents a family from accessing support. By building family-centered, culturally responsive systems, we can ensure that all children, regardless of background, receive the support they deserve. In conclusion, early intervention is not just a special education issue, it is a public investment in our future workforce, communities, and families. The evidence is clear. When we act together, children learn more, families grow stronger, and schools save significant resources in long-term support services. I urge the committee to prioritize policies that expand early childhood screenings, fund family-centered intervention programs, and strengthen collaboration among educators, families, and service providers. Together, we can give every child the best possible start in life. Thank you for your time and commitment to supporting our youngest learners.